Having been a Marvel Comics book reader for about 50 years, that's high praise.
It is high praise. I want to welcome all of you to this Zoom session. In the beginning of Shelter at Home, I started with Zoom sessions that were educational. And after a couple of educational ones, I decided that we were all kind of tired of being educated. So one Saturday night, I thought, who is the most famous person I know? The most interesting person that would answer my email, my text, or my phone call. And since then, we had the CEO of Marvel Studios, we had an international actor, and we had a former professional basketball player. The interesting thing is that although they were all entertaining, and I'm doing these partly to give everyone a break from a COVID world, each one had an amazing nugget of gold that was as valuable as an entire educational session. And I'm sure that this session will be the same. I welcome those that know me. I'm Leslie, Electric Impulse Communication, for any first timers. If I can ever help anyone with a speech, writing or coaching a speech, as a speaker or as a coach, it would always be my pleasure. I want to welcome Scott as our featured speaker today. Scott is an Akron native. He grew up on the west side of Akron, which just goes to show you can get anywhere from Akron. He attended Firestone High School and the Ohio State University. He majored in zoology, which I find kind of interesting, an 18-year-old saying, gee, I want to major in zoology. He spent his career at the CDC. The CDC we hear about just about every single day in Atlanta. He spent a year at the White House working with then Vice President Dick Cheney after 9/11. Throughout his career, he was known for his ability to stay calm in any crisis. Now, Scott is a cousin of mine. Although due to age and geography and family dynamics, we have not talked in decades until a couple Sundays ago. I have to tell you that listening to Scott talk from his science and medical background was even better than eating chocolate. And anyone that knows me knows that there are not many things better than eating chocolate. I did not get his gene of staying calm in any crisis, however. I want to thank you, Scott, for sharing your expertise. In about 20 minutes, I will open up to anyone on the Zoom session asking a question. You can chat me a question before then, and I promise you that even if I ignore the questions, Heather will make sure that I get your question asked. I want to take a moment right now just to do a quick photo of the screen so that we have this forever.
There's 4 pages. We'll have everybody stand still. It's going to take 4 different shots.
Okay, I need 4 different shots. I have 4 pages because, Scott, you are a rock star, so we're just going to do this quickly and we will get started.
Okay, so everybody smile.
Okay, everybody smile. Once. Okay.
One.
Everybody, Doug, hi there.
Okay, and now page 2.
Now page 2.
Smile.
Everyone smile. Thank you.
Okay,
We're going to get ready for page 3.
okay. Next one.
Next one, smile. Hi, Burnett. Thanks for joining us.
Okay.
And the last one. Hi, Kim. I see Kim on Facebook.
And not leave, so everyone smile.
And smile. Hi, Miss
Got it.
Kim Redmond. Okay. Now, before I begin the actual formal questions that, as you can imagine, have changed 100 times in the last week because everything about our world seems to keep changing. Scott, I'm going to ask you, we have a class of students that are in nursing. Can you give them a shout out to these young people, especially in a pandemic, that have chosen healthcare as their profession? A couple words from someone who spent their entire career in the healthcare field.
Well, thanks, Leslie. And I want to start with a couple quick remarks before I get to your question. One is, of course, to thank you for the opportunity here. It's really sort of an amazing thing. You reconnect with one of your family members, and the next thing you know, you're being hauled up in front of a student and being told that you're a bigger draw than the CEO of Marvel comic books. I mean, that doesn't get better than that.
Great. I'm glad I could do that for you.
I also want to give a shout out to a couple people who I have seen online as I've been flipping through the screens here. One is my sister, Laurie Silberstein, also known as Kayanka. Another is one of my old high school classmates, Rob Minster. And the one that I really am surprised to see on this chat is Bill Keck and his wife Ardith. And I'm going to take a little digression here because I think my story and how it intertwines with Bill's are going to illustrate a couple of important points. I went to medical school, a little bit confused, not entirely sure what I wanted to be when I grew up. I had done research in anesthesia for 3 years before I went to med school, so I always figured, well, if I don't find anything else I want to do, I can be an anesthesiologist. And I went to the school they now call Northeast Ohio University, Medical University, NeoMed. And I found out I didn't want to be an anesthesiologist. And suddenly we were about to graduate. I didn't know what I wanted to do when I grew up. I had been struggling the whole time, kind of felt like I was running to stay in place. And I'm sure a lot of you know that feeling. And based on a few interests that I had mentioned, folks referred me to Dr. Keck. And Bill at the time was the health officer for the city of Akron. And he also was the chairman of preventive medicine at the medical school. And it was a spring day, I think early May. You know what spring, May is like in the Akron area. That's when everything's in bloom. We took a walk around the outside of the medical school and he turned me on to public health. And over the years, Bill was a mentor and a friend, and our paths have kind of diverged in the sorts of the things that we've done in public health. And yet I still occasionally bounce things off him as recently as about 3-4 weeks ago. And so the 2 points that I think the story illustrates, I mean, I went from being a confused medical student to someone who's had a career that I've just been able to do incredible things and make incredible contributions and have a lot of fun. And all of that was made possible because Bill took the time to talk to me at a time in my career when I think a lot of the faculty had pretty much written me off. And so the 2 points are, no matter how confused you are, no matter how weird things look, no matter how unlikely your prospects seem, there's hope. You just have to find that right connection, that thing that turns you on. And at the other side, if you're on the other end, if you're that individual who is talking to a person who is confused, who needs an expression of that you have confidence in them and that you have something to share that you think they might find interesting, you never know, what seeds you're casting that may take root and what a difference you may make in that person's life. So from both ends of that interaction, I think I've learned some important things. Now, to get back to your point, because of the career path that I took, I didn't do the kinds of hands-on clinical care that your students in nursing are doing right now and will probably, many of them, be doing for their careers. And yet, because of the work that I did in public health, I have a tremendous appreciation for the importance of the work you folks do. And much of my work at CDC was in many ways trying to support them. I was working in CDC's Occupational Safety and Health program during the early days of the HIV epidemic. And one of the accomplishments that I'm most proud of was some of the things that we were able to do to make frontline healthcare workers safer in terms of protecting them from exposure to HIV and other bloodborne pathogens. people tend to think of there being sort of a separation between public health on one side and clinical medicine, clinical care on the other side. And in fact, the two are clearly intertwined parts of a whole, where we all share the goal of trying to keep Americans and citizens of the world at large as healthy as we can. So congratulations to all of you, and appreciate what you're doing and look forward to the ways we can continue to support each other.
Thank you. That kind of dovetails into my first question. From your perspective, how is it different to hear COVID facts from a medical person rather than a politician or someone that just thinks they read a few articles?
I think we've got a couple people on the line who still have their screens unmuted. So if you could take care of
We're
that.
muting them right now.
Okay. You know, that's a really interesting question. And it's not easy. I mean, you talk to some physicians and they are trying to stay on top of the same literature that I am, which covers everything from what are the most effective treatments to what works best in the community to prevent transmission to what kind of national policies do we need in place. We have other clinicians, other physicians who are so busy taking care of patients that they have to be focused on what are the current data that tell us what are the most effective treatments, what's the best way to prevent the spread of infection within the healthcare setting. And that's their job, that's where their focus is, and that's where that's all they have time to spend attention on. And I think both of those perspectives are equally valid. It's a matter of where you are, what responsibilities you have, and where you have to spend your time. Politicians are likewise sort of a complete spectrum. We have, as you look at the spectrum, at the politicians who are campaigning right now, you see some who are saying, you know, we need to pay close attention to what the science is. We need to focus on the data, the evidence that will tell us not only how do we best treat patients, but how do we arrest the spread of COVID-19 in our communities. You have other politicians who choose to disregard that. They want to campaign on a picture that's as rosy as possible based on quick and easy solutions that often aren't based in fact. And unfortunately, we've seen too many examples of how trying to base policy on promises rather than science leads to disaster. So I'm certainly an advocate of the former and not the latter perspective.
Let me ask you if you have experienced this. Recently on that somewhat infamous 60-minute interview with Dr. Fauci, he said that when he was asked about science being under fire, that there's a movement against authority and science, and that, you know, because there's a movement against authority, science is kind of a victim also. Have you seen that people reacted differently to a science, a medical viewpoint now than they did, say, 10 or 20 or 30 years ago? Or has it always been there? Has it always been this yin and yang between science and us mere mortal people?
I wouldn't use the phrase mere mortals unless you're talking about us versus Superman. I mean, everyone on the call is important. There's always been a community of, there have always been people in the community who don't necessarily listen to what the science has to tell us. You know, pretty much my entire time at CDC, for example, the agency was dealing with communities of people who, for one reason or another, didn't believe the science about the safety of vaccination and the importance of vaccination. Without touting myself as an expert in social movements, I think that there are a lot of people who feel that the two things that are different now compared to earlier times in my career are that we do seem to be a more divided society than we have been in previous years. And the internet and social media not only are effective tools for conveying correct information, they're also effective tools for conveying misinformation. And because we probably have not done the kind of job that we need to do in including science education in our curricula, and now the need to teach people how to assess critically what they read online, we're catching up and probably will continue to catch up for a while.
Recently, I read that saying a country doesn't have to do everything if it does some things right. What have we done as a country right in the last 8 months?
You're regarding specifically related to COVID?
Yes.
I would say that what we have done well is make the information available to tell people what they need to do to protect themselves and reduce the possibility that they would be infected with the SARS coronavirus, or that if infected, they would transmit it in the community. There's no question that that information is out there for people who want to use it. I think that the medical community is racing as fast as it can to identify what are the effective ways to treat COVID patients. And we see now that there appears to be a lower case fatality rate. That is, the percentage of people who get infected with the virus and become ill, who then go on to die, is lower than it was in the early months of the outbreak, probably because we know better how to treat those patients, that we don't necessarily want to rush to ventilators, that certain steroids early in the course of severe illness make a big difference, things like that. And it appears that the vaccine research community is holding fast to appropriate scientific standards on how to evaluate the safety and effectiveness of the different candidate vaccines that are out there, so that when we are told that a vaccine is ready for submission to FDA for approval, that we'll understand what are the data behind that. And the FDA has given us every indication that they're going to adhere to the established standards for reviewing those data before they issue an approval. All those, I think, are things that are being done right.
Well, let me ask you that kind of, the White House got the CDC to change their guidelines on school reopenings, church gatherings, cruise ships. How much should the CDC be influenced by a White House?
That's, you're throwing me the easy questions, aren't you?
Yes. Well,
Okay.
I should say, now that you're retired, so now are you allowed to answer?
Of course I am, and I'm going to answer from several perspectives. And this may be more than you want. I mean, I've been on both sides. I've worked at CDC. I've helped develop guidance. I've also worked in the White House and been a consumer of CDC products. And historically, White Houses have not dictated to CDC for political reasons what that guidance should be. People look to the agency for guidance that's based, again, on the best data and the best science. And to the extent that the agency is given the freedom to do that, that's where we get the best recommendations. I think in every administration, there are people who are tempted to say, you know, it would be so much easier for us if the agency were to say this instead of that. The good administrations resist that impulse. Now and here we get into sort of an issue of government and leadership. This is not the same as saying that an agency like CDC or any other should necessarily be off on its own and doing whatever it wants to in complete isolation. One of the responsibilities of a White House is to ensure that the government, especially during emergency, is attacking the problem in a unified way, that people are in coordination, that they understand what each other are doing, they understand how what they're doing might reinforce or potentially contradict what another agency is doing. And so it's entirely reasonable for a White House to say to the agencies, give us a heads up ahead of time on what you're doing. Participate in interagency coordination meetings. And in those meetings, give people some advance notice of what you're thinking, what you're seeing, and what you're planning. And that way the different agencies can discuss with each other, well, you know, if you're going to say that, then we need to change this policy so that what you're telling the public to do becomes possible. If CDC, for example, says, we think you should be doing this action in nursing homes to protect the elderly who are housed there, then the Center for Medicare and Medicaid Services, which pays those nursing homes to provide that care, may need to change some of its reimbursement policies in order to support those kinds of actions. That's what I mean by saying that.
Has it been consistent? Would you say it's been consistent in these?
I'm sorry?
Has it been consistent, the messaging? Would you say the messaging between the CDC and the White House has been consistent?
Unfortunately, I think in this administration, we've seen White House messaging that has not been consistent. That's been problematic. I think it confuses people. I think CDC has tried to be more consistent to the extent that they've been allowed to. I expect that they will continue to try to do so.
One more question before I go to your time at the White House. You know, Dr. Fauci's come under a lot of fire because early on he said you didn't have to wear masks and then masks. And to some people, that's a reason not to believe anything. Can you talk to us about, you know, the more that we understand this disease, you know, perhaps how has it changed what the medical field sees as appropriate response?
Well, let me start with the specific and then move to the general. As I understand it, at the time Dr. Fauci said that, there were two things that were going on. One was that some people, he among them, had recognized that nationally we were facing a mask shortage. And it was, and it remains, critical to ensure that the frontline healthcare workers, like the nursing students here that we talked about earlier, have access to effective personal protective equipment so that they can deliver care to COVID patients while minimizing their own risk of on-the-job infection. We also weren't seeing the magnitude of community transmission that followed later. And eventually, what changed was that we recognized that there was benefit to people wearing not those expensive N95 masks, but just cloth masks in the community, that would have some benefit, and that it was possible for people to acquire those without restricting access of the other types of PPE to healthcare workers. So that changed, and I think that is part of the reason why Dr. Fauci's guidance changed. To take a step back now to the general case, I want to illustrate this with an episode from the 2009 H1N1 influenza pandemic. At the time, Rich Besser, who later went on to be on ABC and now directs one of the major medical foundations in the country, Rich was the acting director of the CDC. And during his press conference, his first press conference about the influenza pandemic in his capacity as CDC director, one of the things he said was that we will tell you something today, and we may learn things in the next few days so that the next time I tell you, it'll change. That's because we always want our guidance to reflect our most current science-based understanding of what we should do. And so he was carving out from the beginning an understanding in the public mind that the situation is fluid, that our understanding will change and our guidance may have to change to reflect it. And just because guidance changes doesn't mean that things were invalid or that the speaker isn't credible. In fact, it means that the speaker should be more credible because they're staying on top of an evolving situation. Leslie mentioned one of my interests in leadership during crises. This is one of the great illustrations of a trait of crisis leadership.
I'm going to really put you on the hot seat with this question. Sunday in the New York Times, there was an article that said that the current CDC, administrator is not the A team.
I'm sorry,
Is not the A team.
Is not the A team.
Any comments?
I don't know Dr. Redfield. I've never met him, and I don't know what he's doing behind the scenes, aside from the public presentations that he gives. So I don't think I'm qualified to answer the question. I'm sorry.
Oh, it's okay. Before I go to the White House, let me just ask you to weigh in on herd mentality. At the moment, the doctor that appears to have the president's ear is Dr. Scott Atlas, not a specialist in infectious disease, but a proponent of herd immunity. So can you comment on that?
I'm not one who believes in herd immunity, and I think the data that are available to date, both from the United States and from other countries, indicate that it's really not a good strategy. We see that for all the pain and suffering that we've had in this country so far, including over 220,000 Americans dead of COVID-19, that our the serological surveys that have tried to estimate how many people have already been infected and have antibodies in their blood indicate that we're only at about 10%. And the best estimates out there right now of what level we'd have to get to reach herd immunity is around 50 to 60%. Some people originally said 70. It seems to have come down a little bit from that percentage. So imagine going through this, all those multiple times to try to reach what they call herd immunity. The other example that I would point to is Sweden. There's this notion, people point to Sweden and they say, well, the Swedes have decided to protect their vulnerable and otherwise open the community, and thereby they'll achieve herd immunity. What we've seen in Sweden is that you can't protect your vulnerable people when you're allowing free transmission in the community, because young people in the community go see their parents go see the grandparents, the virus gets passed around through all those contacts, and Sweden has had something like 40% of its deaths have been in elderly who were in elder care housing situations. So the idea that you could isolate them turns out to be fallacious. The other thing about Sweden is that their death rate has actually been higher than that of some of their surrounding neighbors, including Finland and Norway, who took more restrictive approaches. So I think all of that evidence put together indicates that the idea of herd immunity is one of these things that sort of makes sense on paper and not in real life.
You worked at the White House, Vice President Cheney's medical advisor for Homeland Security Affairs. Can you tell us some highlights from working at the most well-known address in America and maybe the most well-known address in the world?
Okay, a little background first of all. When we say the White House, there's of course the big white building that the president lives in. There's also a couple other buildings that are nearby. One is this beautiful, I can't remember the architectural style, but it's 1800s vintage building right next door called the Eisenhower Executive Office Building. And a lot of people we call White House staff actually work there. I was among them. Now, when the president issues a new policy, signs an executive order, things like that. The president isn't developing that on his own. He has staff that are researching these issues for him, are making recommendations, giving him options, and he'll pick the option that he likes best, and then that's what gets issued as policy. Going back to the Truman administration after the Second World War, President Truman, up until that time, the group that had been advising the president on foreign policy was the State Department. And after the Second World War, the Department of Defense said, you know, if you're going to make foreign policy, it's often we are the ones that have to enforce it. So we want a voice at that policy setting table. And in response to that and some other concerns, Truman created the National Security Council. And the National Security Council brings in people from federal agencies on temporary assignment to work in the White House to help the president keep eye on what's going on around the world and develop United States foreign policy. Over the years, national security has broadened to include homeland security. And so you have staff in the White House who are dedicated to homeland security affairs as well. And homeland security includes pandemic preparedness. It has been a larger part of other administrations than it was in this administration before COVID occurred, but there's ample precedent.
So give us one highlight from working under Vice President Cheney.
For me, the biggest highlight gets back to something I talked about earlier, and that's interagency coordination. A successful White House will define an issue, bring in the interagency representatives, sit them around a table, and say, here's the problem. What are we going to do about it? Who has what assets they can bear to bring on it? Who has what challenges that might be affected by this? And through that, you develop a harmonious national policy. And to me, the most exciting thing was being at that table, being able to raise these issues, being able to point to different people around the table. And sometimes you had to, not everyone is as forthcoming as I am. Some people are kind of reticent to speak, and you have to make a deliberate effort to go around the table. And if a representative from an agency hasn't been talking, to say something to draw them out, because they may have a critical perspective. And I just loved that process of being part of facilitating to help the country get to an effective and feasible policy.
Thank you. I'm going to open it up. I have a feeling that a first question is going to be about the vaccine, but who would like to ask Scott the first question? Who would like to unmute themselves and ask the first question?
With the caveat that I am not a vaccine expert.
Hey, I'll go first.
Okay, Mark.
I guess I got to put my video on too, or do I?
Yes, you should, so Scott can see you.
All right, let's figure out how to do that. There we go. Hey, Scott, it's been a long time, but here's my question. So, we're watching the news about the COVID and infections and whatever, and aside from that aircraft carrier that had some infections, there has been zero conversation about any of the military branches contracting the virus. Do they not talk about it because it's, a matter of national security, or for some reason, the military does not have the virus?
The military definitely has the virus. I'm not sure why it's not drawing the media attention that you're looking for. I have seen some articles talking about how the military is dealing with cases. It's funny that you mentioned this. I have a faculty appointment at the Uniformed Services University of the Health Sciences, which is the nation's military medical school, trains doctors and graduate degree nurses in military service. And they're having a presentation next week on how they adapted Marine training at Parris Island to try to reduce the risk of COVID-19 transmission. I'm speculating here, which is always dangerous, but it may be that because the military can require certain behavior on the part of its members, its active duty members, that maybe they've had an easier time of reducing transmission risk than in society where many people have chosen not to follow recommendations.
So just a real quick follow-up, and then I'll turn it over to Leslie. So do you think, and I realize you're speculating, but just curious, do you think it's the military has therapies that they're using that we don't know about? Or do you think the military has been contacted to provide the testing that we hear about with some of the different drug companies?
I'm not sure what you mean by the testing with the different drug companies.
Well, they have volunteers
Ah,
that they're testing various formulas and vaccines and things.
okay. So I think the answer to all those questions is no. Let me explain why. Dating back to the late 1990s, there was a recognition back when it was in the late 1990s that organizations like the CDC started to ask themselves, what should be public health's role in preparing for and then responding to a pandemic or a bioterrorism attack. And CDC and its parent department, Department of Health and Human Services, were very much involved in exploring those questions. And out of that grew the challenge of, do we have the right drugs to respond if something like this happened? The antivirals we have for influenza aren't as good as what we would like. If we had a smallpox outbreak, we haven't really been keeping an inventory of vaccines since smallpox was eradicated in the 1970s. And the military and the civilian side have the same interest in protecting people. The military needs to protect not only its active duty personnel, but their civilian family members. The Department of Health and Human Services needs to protect the rest of the country. So there was sort of a convergence of research efforts where research that one side was funding would be made available to everyone. So you really don't see, research that's only done by the military to try to develop some kind of medical therapeutic that only they have. It's very much a coordinated and transparent system that they've developed. With regard to whether or not the military are being recruited as subjects in vaccine trials, I haven't seen anything about that, and I've certainly read a lot about civilians who have been recruited, who are candidates who have been receiving the candidate vaccines. In fact, I have two friends who are participating in a vaccine trial that's being run at Emory University here in Atlanta, and they're both retirees from CDC. And so I think they're getting enough uptake from civilians that they don't need to turn to the military.
I'm going to ask you, I'm preparing for the next question. A yes or no answer to two questions. One, if you were in charge of everything to do with COVID, would you have schools be open?
Would I have what?
Schools be open.
The answer to that is that I would leave that to be a local decision based on local conditions, but I would ensure that nationally we had issued clear, understandable, science-based guidelines that local authorities could use to make that decision based on what's the rate of transmission in the community.
Okay, would you have a maximum number of people that were allowed to gather?
Again, I think I would I would want to turn to the science on that. I think we do know that large gatherings of people who are close together, particularly indoors without protection, are very high risk for transmission. To answer your question about numbers without talking about where and how far apart they are, I think wouldn't be appropriate. So again, we want guidance that helps people walk through decision trees to help them make a decision based on their particular circumstance.
Okay. I open a question to someone on our session. Anyone have a question, perhaps about vaccines, long-term consequences?
I do have a question about vaccines.
Yes, Maggie.
You yourself as a doctor, would you feel comfortable with taking a vaccination that they put out quickly if they do put something out?
Assuming that that vaccine has gone through rigorous trials for both safety and effectiveness, that the data have been made available, and that the FDA and a group that CDC hosts of outside experts called the Advisory Committee on Immunization Practices, ACIP, have all had the opportunity to review those data and have come to the conclusion that the vaccine is safe and effective, I would say yes.
Okay, thank you, sir.
Do we have another question out there?
Marcia, you're on mute.
There we go. I just want to mention that the chat room has some questions in it.
Yes, I've been trying to get to some of those. Thank you.
Okay, thank you. And a very enjoyable talk.
Great.
Thank you.
Anyone? You've spent your life in infectious disease.
Actually, I didn't.
You haven't.
No.
So okay, so comment on that, please. Because when we think of the Center for Disease Control, that's kind of what we think of.
It is what people think of, but actually CDC is much larger than that. I spent my first slightly more than half of my years at CDC doing research in occupational safety and health, looking at what are the hazards in the workplace, how do they kill, injure, or make ill the workers, whether that's chemical exposures in factories or infectious disease exposures in healthcare, and how can we prevent them? And it was sort of a dual relationship with OSHA. We developed the science by which OSHA used as the basis for their regulations. So we were the science arm, they were the enforcement arm. However, in that work, in the late 80s, early 90s, when we still didn't have effective medical treatment for HIV, I became interested in HIV and then other infectious diseases in the hospital as occupational health risks for healthcare workers. In fact, I met a physician who had gotten exposed to infected blood while he was a resident at Johns Hopkins. And because these were the days before effective antiretroviral treatment, it eventually killed him. Working with colleagues at the Food and Drug Administration and OSHA, we were able to effectively get out of the marketplace the device that had caused his infection. So that kind of work was my entree back into infectious diseases, which led to my work in CDC's bioterrorism prevention program. But then I shifted and I spent the next 14 years at our National Center for Environmental Health, which looks at what are the hazards in the environment that affect people's health: air pollution, water pollution, all sorts of things. And I was responsible for preparedness for and CDC emergency responses to chemical, radiological, and natural disasters. Occasionally, I would pitch in and help with an infectious disease response, but that wasn't my primary duty.
I'm still getting questions about masks. Do you think masks are as effective as people think they are?
I think they make some contribution in reducing the risk of transmission. I'll be honest with you that I think we're still understanding how effectively they prevent me transmitting the virus. And it's probably more effective as a means for that than it is effective in protecting me from the virus. Now, when we say masks, again, we're talking about the kind of cloth masks that you see people on the street wearing. They do make some difference. A lot of this gets tied up into our evolving understanding, and there's that word again, evolving, of what percentage of COVID transmission is related to large droplets that quickly fall out of the air or get caught in a mask, and what percent is related to aerosols, very fine droplets that stay airborne for a long time. And we're still learning about that, and I'm not one of the experts in that, so I read that literature about as avidly as you do.
Do we have one last question for Scott?
I have a question.
Yes.
Okay, so my question is looking forward. How do we move on from this, and what are our plans in terms of a next outbreak? How do we prepare as a nation?
That's a great question. Let me take the second part first. Looking forward to the next pandemic, how do we prepare as a nation? I think it's a very insightful question because it shows the understanding that there will be other pandemics. There are other infectious diseases out there. And as one person said, Mother Nature is the worst terrorist. I think it's critical that we learn from this pandemic. We learn what we did right, and we learn from what we did wrong. And I feel so strongly about that back in April, in the Washington Post, I was a co-author of an op-ed that called for the nation to establish a COVID commission, a bipartisan commission. Some of you may be aware that after the 9/11 attacks in 2001, we had a bipartisan 9/11 commission to look at how did the country get caught off guard? How did our response go? What lessons do we need to learn from that? We need to do the same thing to learn from COVID-19 because there is no better way to build a better system than to learn from experience. And so I very much hope that after the election, whichever administration is in power, we'll take a look at that suggestion. Moving forward from here, where we are today, obviously we need to proceed with the vaccine research. We need to identify a suitable vaccine. We need to get it out. As Michael Osterholm, who's an infectious diseases expert I follow, has said, it doesn't matter when you have a good vaccine. What matters is when it's in everybody's arms. So we need a distribution campaign coupled with a public education campaign to reassure the concerns of people who might otherwise be afraid to take it. We need to come together. We need to respect each other. We need to recognize that we're in this together, that COVID-19 is real, and that only by addressing it together are we going to get through this. So in some way, we need to heal our divisions and link arms, much as the way people have done in national crises, including the Second World War. And I think when we see people working together in that way, nothing can stop us, not even the virus.
Thank you. I would love to stay on longer, but I thank everyone for joining us. I thank all of you for joining us in my quest for the most famous people who will answer my email, my call, and my text. We have been so fortunate today to have Dr. Scott Deitchman. And let me just add Rear Admiral, because this is probably the first and only time in my life I will have the opportunity to call someone a Rear Admiral that is in a Zoom session. Science and medicine used to not be politicized. Today, we got to hear from an expert in the science and medical fields. I trust you to take this information and do with it the best that you can in your lives. I'm Leslie. Glad to help you as a speaker, coach, a speechwriter. I thank you and hope to see you on our next Zoom session, which may be with Coach Jim Tressel. I thank all of you for being here today. Scott, I thank you so very, very, very much.
Leslie, thank you for having me, and everyone else, thanks for being on board.
Thank you. Bye-bye, everyone.
Thank you. Well done.
Thanks, Lisa.
It was great. Thanks.
Great job, everyone.
That was great. Thank you.
Thank you.
Pleasure.
Yeah,
Thank you.
your last comment.
I'm just sorry we didn't get to all those chat questions. There are so many there. There are
Thank
just so many
you.
there. It was
Thank
very
you.
interesting.
Good summary, Scott.
Really good summary.
Maybe a take two. Bye-bye.
Good idea for take two.
I'm up for another one. How about you, Scott?
Thank
Sure.
I think if there ever comes a vaccine, we'll definitely need one as a public service to have another one.
Well, I can tell you some people shedding tears and bursting with pride from above.
I am sure.
Uh-huh.
I'm sure.
Yeah, Nana, Maki, and all 4 of our parents.
Yep.
And
Yeah,
Scott,
hi, Lori.
Hi.
Scott carried on the tradition of Deitchman's being doctors.
Did.
There were people who were disappointed that I didn't go into private practice, but I think I've had more fun.
I think you've had a bigger impact in a very different way.
You made
People
up for it.
People who take care of patients have a big impact.
We thank you for what you've been doing for our country all this time. And it's a labor of love, I'm sure.
It has been.
You know, Scott,
It's been a privilege, seriously.
I heard from so many people, I hadn't even thought about it, that just on my email, my constant contact list that went to school with you.
Yeah,
From Rick Marks. I see Bruce Hennis. Bruce has to remember.
right. I see Carol
right?
Hertz. I see Carol Hertz as well.
Yes. Yeah.
Can you send me the chat and the list of the emails, and I'll reach out to the folks that.
Yes.
All right. Thank you.
Yes. It's amazing. So many decades you've been gone from Akron and still remembered.
Well,
I better not say that.
I was just thinking we may not want to deliberate that too much for any of us that left.
I was surprised by
most of these.
what they remembered. Like, yeah, I remembered he was one of the smart ones.
Yeah,
Oh,
they
Rob,
probably,
I was waiting to see what Rob looks like because you were the little brother. It was your sister that I was close with.
I thought people were going to remember me as the kid who always got picked last for the baseball team.
Good one, Scott.
That's better than the one not getting picked. So yeah.
If they'd had that choice, they would have taken it.
I
think
knew
I
you would
filled that
be so
role.
smart. I'd have picked you for baseball.
All right, that's
I remember
nice way too.
Remember the one time in high school gym when I hit a home run, and it was just because of that remarkable combination of outfield errors.
But it happened.
That's true. It did happen. And thanks, Marcia and Lois, for coming in from Tucson.
Thank you for inviting.
Thank you.
for inviting me.
Yeah, thank you for inviting me.
I know, Lori, I can't believe what Scott said this morning. I said I sent it to you last night, and it was like everyone forgot the sister.
Exactly.
Mea culpa.
I think, Leslie, you did a very good thing to put this on. And Scott, continue. I know that you're retired now, but I'm sure you are continuing to have your input known. And that's wonderful.
Yeah, one thing that we didn't really talk about, let me just see. Had sort of a crisis of conscience the last couple of weeks. For years when I was working as a federal employee, I could not be politically active. And there are people like this Michael Osterholm, whom I previously mentioned. Incidentally, if you folks want a great place to go for updates on what the science is telling us about COVID. Michael runs a research center at University of Minnesota called CIDRAP, CIDRAP. And their website is great. And Michael is scrupulously apolitical. He'll bend over backwards to avoid criticizing a particular politician or administration because he feels like he won't get listened to. And I just felt like in this election, finally got to the point where the stakes were too great and I had to get involved. So a lot of what I have been writing for the public is based on the science of where we are, but it criticizes political decisions that have been made.
I'm grateful for your being politically involved.
Got to be a very rough bridge to walk.
Where could we find your writings?
I've just had a couple posted on Medium, which I wasn't familiar with until this. And I've posted quite a bit on LinkedIn. I've got one op-ed that's out there with a couple media outlets. If it gets published, I'll shoot it to Leslie and she can distribute it.
Sounds
If
good.
y'all contact me on LinkedIn, I'll connect with you and then you have access to it all.
Will do. I can spell Deitchman.
Nobody else can. Why should you?
My family was Deitch. They left off the man.
Ah,
I had cousin Deitch.
I sometimes wonder what people would do if I went back to Teitzel.
I was just going to say, we all
I
learned
think
just
that-
3 months ago that Deitchman was not even the name in Russia. We just found that out through a cousin Zoom.
Yeah, we'd heard that before, and it was in Belarus, wasn't it?
Yes.
Was it? I just know when I found Maki's